Hi, my name is Tasha, and I'm going to be performing the eye medication administration skill video. To begin, you do want to make sure that you verify the orders from the provider. You do want to verify the 6 rights of medication administration, which is going to be the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. You also are going to want to check and verify that the orders match what is in the electronic health record as well. The medication we will be using today is going to be the Timolol 0.25% solution. We will be doing 1 drop each eye twice a day. At this time, I'm now going to be introducing myself to my patient. Hi, my name is Tasha. I'm going to be your nurse today. All right, I'm going to provide patient privacy as well. May I have your first and last name, please? Thank you. And your date of birth? Thank you. I'm also going to verify that with the patient on the wristband as well. All right. So do you happen to have any allergies to any medications? Okay. What about food allergies? And seasonal allergies? All right. So at that time, if the patient were to say yes to anything, I would document that into the patient's chart. So today we are going to be applying some drops to your eye. This is to relieve the high pressure due to glaucoma or any other diseases. All right. You may feel some stinging or some burning while I am applying the medication. Okay, and some side effects may include some blurriness, you might have some redness, even headaches. If you happen to have any side effects, please let me know immediately. All right, do you have any questions? Okay, thank you. All right, so at this time I'm going to be washing my hands, providing hand hygiene. Okay, I'm going to be applying my clean gloves. I'm going to make sure that my patient is in a comfortable position, lying supine, or if they're sitting up, that their neck is hyperextended, so that I can get them, get everything appropriately and whatever is more comfortable for the patient as well. I am going to, at this time, get my wet, warm washcloth so that I can begin to clean the eyes, and you want to do that starting from the inner to outer canthus. If the patient has any crustiness, you're going to want to remove that as well. So we'll start here. All right, and you'll want to do the other eye as well. Perfect. And you're also going to want to dry it as well. From inner to outer canthus. And inner to outer canthus. Okay. Once I have cleaned the eyes, making sure there isn't anything crusty in there as well, I'm going to be removing my gloves. I will perform hand hygiene. And then I'm going to apply a new pair of clean gloves. I'll make sure that I have a clean tissue and my medication. This time I'm going to be pulling down on the cheekbone area with a little bit of pressure. You do just want to make sure that you can reveal the conjunctival sac. You also want to place your hand on the patient's forehead above their eyebrow. You do want to ask the patient to look at you directly. Okay, try not to blink. At this time, I'm going to be applying the medication. You're going to do 1 drop, 1 to 2 centimeters from the eye. Okay, and then you're also going to want to repeat that for the other side. Pulling down on that cheekbone area, revealing the conjunctival sac, applying your hand above the eyebrow on the forehead. Please do not blink, stare up at me, and you'll apply that 1 drop, 1 to 2 centimeters from the eye. If the patient happens to blink at any time during the medication administration, you are going to want to repeat doing the medication, as it does not get into the eye if they do blink. Also, if the patient happens to have the medication for systemic effects, you are going to want to apply pressure for 30 to 60 seconds on the nasal lacrimal duct with a cotton ball or gauze, for the patient. Just light pressure on each eye, if that's the case. Okay. At this time, I'm going to ask my patient how they're doing, if they're comfortable, make sure that they have all of their things next to them, the call light, their cell phone, whatever it is that they need. Ask if they have any questions. I'm going to clean up my mess at that time. I will perform hand hygiene, and I will document all the information into the patient's chart.